In an address to the nation Monday night, President Irfaan Ali announced increases for doctors, nurses and support staff, which will take effect from January 1st, 2023, and is in addition to the recently announced 8% retroactive increase for 2022. There were major increases ranging from 20 to 75%. According to Dr. Ali, these revisions to the salaries of these workers will benefit over 5,000 persons and will increase disposable incomes by over $1.5 billion annually. Medical interns will now have their current minimum salary increased from $151,000 to $200,000, representing a 32.1% increase, while medical officers will now have their current minimum salary increased from $219,000 to $300,000, representing a 36.4% increase. Specialist doctors will now have their minimum salaries increased from $276,000 to $450,000. This represents an additional 62.7% increase on the current minimum salary. Midwives will now have their current minimum salary adjusted upwards from $96,000 to $169,000. This represents an additional 74.7% increase on the current minimum salary paid to a midwife. Staff nurses will now have their current minimum salary adjusted upwards from $111,000 to $169,000. This represents an additional 51.8% increase in the current minimum salary paid to staff nurse. In addition to these increases, the government has also moved to address an anomaly in the system to ensure that all doctors across the country can benefit from experience-based pay increases. Historically, doctors at the Georgetown Public Hospital Corporation, GPHC, are recognized for the years of service they have, with an increase in pay offered for every additional year they spend in the public healthcare system. That did not obtain at healthcare facilities in the rest of the country. But according to Finance Minister Dr. Ashni Singh, the government is finalizing that anomaly now.
We're fixing that anomaly now. So across the entire public healthcare system, whether you're working in GPHC, or Linden Hospital, or Mabaruma Hospital, or New Amsterdam Hospital, or Lethem Hospital, wherever you're working, this graduated system that remunerates you at one level when you're an intern, moves you up when you become a full-fledged GMO, when you're qualified fully as a doctor, you become an entry-level GMO or a government medical officer, moves you further up when you complete 1 year of experience, 2 years, 3 years of experience. That arrangement, which previously obtained only a GPHC, is now applied across the entire system.
The Finance Minister joined Health Minister Dr. Frank Anthony for a special discussion moments after the President's announcement on Monday, offering further details on the remunerated benefits being offered.
We're building new facilities, putting in new equipment and all of that. The environment here to practice medicine is changing drastically. Also, the types of training that we've been offering would allow people to want to be here, to be proud to be here, and to be able to do cutting-edge medicine. That's what we're gearing the system towards. And with this increase in salary, certainly we are going to become more competitive in terms of retaining persons in the system and being able to offer better quality of care.
According to Dr. Anthony, with this increase in salary, Guyana's healthcare system stands to become more competitive while offering better quality care.